Welcome to In-Service Skills and Safety Training. The first part of the training will focus primarily on personal care attendants' skills in home care. Why is skills training important to LRHC? At LRHC, training and development is not just required, but encouraged. As skills and knowledge of personal care attendants improve, so does the quality of service that is provided to our consumers. Our current internal mandatory trainings include new hire orientation and in-service trainings. Our current internal voluntary trainings include Hoyer lift training. Current Union Hub mandatory training includes CPR first aid. So CPR is the only training offered through the Home Care Hub that is mandatory, and all personal care attendants need to have CPR training. If you're a new hire, it needs to be done within the first 6 months of your hire date. Moving on, the current Union Hub voluntary trainings include mental health first aid, dementia capable care, nonviolence crisis intervention, ADLs and IADLs, medication safety, nutrition and diet, or nutrition, diet, and exercise, among other courses. Completing Union Hub training courses, especially designed for home care workers, should improve your efficiency. Example, completing dementia capable care courses or dementia capable care should help in understanding the illness, identifying signs, and know how to navigate and avoid triggers. Skills is essentially one's ability to use one's knowledge effectively and readily. There are two types of skills: soft skills, which are inborn traits and abilities, and hard skills, which are essentially taught skills. LRHC personal care attendants perform various non-medical skilled services. Non-medical is highlighted here because although some of you may possess medical licensing and certification, such as CNA or RN, most personal care attendants at Liberty are hired as non-medical personnel. Here is a list of skills that we will cover as the training progresses. Hand washing is one of the primary methods of infection control. The Centers for Disease Control, or CDC, recommends washing hands with soap and water for at least 20 seconds to remove germs and chemicals. Bathing. Your involvement in this task is dependent on the specific needs of your consumer. Some consumers may need more assistance than others, and that's dependent on your consumer's specific care plan. At LRHC, we are bound by consumer choice. Therefore, we must accept their choice not to shower or bathe. To be resourceful, you could suggest a quick bird bath instead or check again later. This is also a great opportunity to communicate and gauge your consumers' preferences, such as if your consumer prefer to bathe or shower in the mornings or at night before bed. Remember, if you must assist your consumer with this task, check for sores and rashes and immediately address the issue. Proper oral hygiene helps to reduce the spread of certain infections. It also prevents health issues related to oral disease. Accept the consumer's choice not to brush. To be resourceful, you could suggest rinsing with mouthwash or baking soda. Skincare. Some consumers may require more help than others with skincare. Maybe you find that based on your consumer's skin condition, using a fragrance-free soap for sensitive skin might work best. This is how Thorough communication will come in handy and improve resourcefulness. Any changes in the consumer's skin color should be documented and reported, as it could be an indication of a developing medical condition or sign of decline. Dressing and undressing. Ensuring that we aid consumers, specifically those with limited to no mobility or mental health challenges, in this task goes a far way in them maintaining an acceptable appearance. Unkempt consumers may appear to be neglected consumers, which reflects poorly on you as a personal care attendant. Routine grooming helps prevent lice, dandruff, tangled matted hair, and the spread of germs. Routine grooming also helps your consumer feel more confident overall. Some of you may have consumers with limited or no mobility who require more help with grooming. Avoid using sharp objects on your consumer. Seek support from your scheduler if the consumer insistently requests. If range of motion or ROM is on your consumer's care plan, you want to maintain consistency with it, as it may be critical to their health improvement and can show signs of decline. There are two types of range of motion. Active range of motion is where the consumer does it independently, and passive range of motion is when consumers need assistance. While performing range of motion, you will see changes and know what they mean. Observe for changes and document and report changes to your scheduler. Some consumers need a little more help with toileting than others. On the illustration, you see the different tools for toileting assistance. Be sure to observe for changes in color, odor, frequency, and discomfort in urine and stool, as changes may indicate a medical condition developing and/or worsening. Document and report any changes that you observe. Depending on your consumer's care plan, feeding and meal prep might be a mandatory service you provide. A dietary restriction, or DR, is defined as a reduction of a total nutrient intake without causing malnutrition. Diet restrictions may be included on the consumer's care plan due to allergies, illness, medications, personal dietary practices, religious beliefs. Ensure that you are clear on how to approach diet restrictions by discussing or directing any questions or concerns to the scheduler. Failure to do that can result in an allergic reaction, hospitalization, and even death of your consumer. Contact the scheduler for support if consumer is directing you to go against dietary restrictions on their care plan. Here are a few meal prep tips to follow. Get to know the consumer's kitchen, do inventory periodically, get the consumer's input on what to prepare, do not force the consumer to eat what you prepare, wash hands to reduce contamination, clean prep areas before and after, follow proper guidelines on how to cook and store foods, check expiration dates periodically. Consumers with limited to no mobility may need to be transferred for multiple reasons, whether it be for toileting or bathing. There are different types of transfer devices to aid attendants with transferring their consumers. For example, a wheelchair, Hoyer lift, standing lift, sliding board transfer, or gait belt. Here are some transfer tips to follow. Communicate your intentions to your consumer. Communicate with the consumer throughout the process. Try to limit the number of transfers needed. Practice good body mechanics and know your physical limits. For example, some attendants may have functional issues, which prevents them from lifting. Next tip, ensure that the consumer's home is lift friendly. Please note that we offer Hoyer lift training upon request from attendants or recommendation through your scheduler. If you feel like you need a refresher training or you are interested in learning and certification, please notify your scheduler. Hoyer lift trainings are paid and are conducted on Thursdays between 12:30 p.m. and 2:30 p.m. The second part of the training focuses on work safety. Why is safety important to LRHC? Let's answer this question together. LRHC takes safety of personal care attendants seriously. LRHC understands that working in home care is risky due to limited support resources such as other staff members, lack of available assistive devices, or lifting equipment. As a personal care attendant, you generally operate alone, and the overall responsibility for the welfare of your consumer rests on you. Please request devices or equipment whenever the need arises. Hoyer lift request, for example, may take some time due to the process. Hoyer lifts need insurance authorization to be provided to consumers. Note, Hoyer lift requests can be made through the Consumers Supports Coordinator. Safety is essentially the state in which hazards and conditions are controlled to preserve overall health and well-being. LRHC continuously takes steps to lessen employee risks and exposure to workplace safety hazards. We do this by conducting annual in-service safety trainings and adhering to Occupational Safety and Health Administration guidelines such as protecting healthcare workers from hazards specific to the home environment, infection control, workplace violence prevention, ergonomic considerations, particularly concerning consumer handling, safe consumer handling techniques, proper hand hygiene, appropriate use of personal protective equipment. Let's look at the 4 types of workplace hazards. The first one is chemical hazards, and this occurs as a result of exposure to liquids, gases, fumes, etc. Biological hazards occur as a result of exposure to blood, fungi, animal droppings, or mold. Physical hazards occur as a result of exposure to radiation, extreme weather, or working in loud noises. And ergonomic hazards occur as a result of exposure to awkward posture, repetitive work, or overexertion. According to the Bureau of Labor Statistics, ergonomic-related disorders account for 33% of all employee injury and illness cases. Here are the safety topics that will be covered. According to Occupational Safety and Health Administration, or OSHA, personal protective equipment is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. Personal protective equipment may include items such as gloves, safety glasses and shoes, earplugs or muffs, hard hats, respirators, coveralls, vests and full body suits, hand sanitizers, and face masks. The barriers that the personal protective equipment creates has the potential to block transmission of contaminants from blood, body fluids, or respiratory secretions. Effective use of personal protective equipment includes properly removing or disposing of contaminated PPEs to prevent exposing both the wearer and other people to infection. When used properly and with other infection control practices such as hand washing, using alcohol based hand sanitizers, and covering coughs and sneezes, it minimizes the spread of infection from one person to another. PPE may also protect patients who are at high risk of contracting infections through surgical procedure or who have had a medical condition, such as an immunodeficiency from being exposed to substances or potentially infectious materials brought in by visitors or healthcare workers. Universal precautions, also called routine practices or infection control procedures, are a standard set of guidelines aimed at preventing the transmission of bloodborne pathogens from exposure to blood and other potentially infectious materials. According to the Occupational Safety and Health Administration, or OSHA, universal precautions, or UP, originally recommended by CDC in the 1980s, was introduced as an approach to infection control to protect workers from HIV, HBV, and other bloodborne pathogens in human blood and certain other bodily fluids, regardless of the patient's infection status. Examples of universal precautions include hand washing, using personal protective equipment, respiratory hygiene, such as covering mouth when coughing or sneezing, cleaning and disinfecting surfaces, waste management, that is, properly disposing of medical waste, education and training, which is providing healthcare workers with education and training on universal precautions. Observing and adhering to universal precautions goes a far way in infection control. Respiratory infections have proven to be the most difficult type of infections to control. Examples of respiratory infections are COVID-19, flu, common cold, tuberculosis, or TB. The spread of respiratory infections can be controlled by proper use of PPEs like gloves, masks, and sanitizers, as well as frequent hand washing. In healthcare and public health practice settings, infection control refers to the actions and programs used to reduce or stop disease incidents, new infections, reducing the disease prevalence, or eliminating the disease. There are three categories of infectious disease control. First one is primary prevention, and this seeks to inhibit infections from occurring by providing information on the disease, making vaccines accessible or mandatory. Next is secondary prevention, and this seeks to detect and manage infections early to avoid severity or spread by isolating infected individuals and contact tracing. Third is tertiary prevention. Tertiary prevention seeks to manage existing and symptomatic infections to lessen its severity by providing restorative and rehabilitative treatment to minimize long-term damage and improve quality of life. The Occupational Safety and Health Administration, or OSHA standards of walking, working surfaces apply to all permanent places of employment except where domestic mining or agricultural work is performed. Slips and trips can result in falls, possibly disability or death. The results of these accidents can be extremely costly to the employee or the employer. OSHA data indicates that slips, trips, and falls cause most general industry accidents and causes 15% of workplace deaths. According to the National Safety Council or NSC, slip, trips, and falls cause 60% of non fatal work injuries. Slip, trips, and falls are 100% preventable and generally can be avoided if simple measures are taken. Common causes of slip, trips, and falls are uneven floor surfaces, wet or slippery floors, changes in levels, occasional spills, weather hazards, loose or unanchored rugs or mats, trailing cables, poor lighting, poor housekeeping, open drawers or file cabinets. Both slips and trips result from some kind of unintended or unexpected change in the contact between the feet and the ground or walking surface. This fact shows that good housekeeping, quality of walking surfaces, selection of proper footwear, and an appropriate walk pace are critical for preventing fall incidents. Good housekeeping is the first and most important level of preventing falls due to slips and trips. Tips to prevent slips, trips, and falls are cleaning up spills immediately, mark spills and wet areas, mop or sweep debris from floor, remove obstacles from walkways and always keep walkways free of clutter, securing mats, rugs, and carpets that do not lay flat, always close file cabinet or storage drawers, cover cables that cross walkways, keeping work areas and walkways well lit, wear proper footwear. Home care sometimes requires lifting, and lifting requires good body mechanics. Good posture and lifting habits significantly reduces the risk of strains, sprains, and back injuries. Practice proper posture and body mechanics when lifting by bending hips and knees close to the objects and keep your back straight. Use strong muscles for the job, such as shoulders, upper arms, hips, and thighs. Use your body to push or pull whenever possible. Avoid twisting body when you turn. Turn feet and entire body when you change directions. Avoid bending for long periods. And if something is too heavy, get help. Number six is referring to making requests for lifting aids if you need to do so. Larger lifting aids may need to be requested through the Consumer Supports Coordinator. Smaller ones may be requested directly through your scheduler. All lifting equipment requests can be made directly through your scheduler, who can send an email on your behalf. Emergency preparedness refers to steps you take to make sure you and anyone in your care are safe before, during, and after a natural or man made disaster. Persons with disabilities and elders are more vulnerable during and after emergencies. Emergency planning is very important to the welfare of our care dependent consumers. Here are some tips for emergency planning. 1. Consider your unique needs and the unique needs of your consumer. Make a disaster supplies kit. 3. Know where to go. 4. Stay connected. 5. Protect pets. 6. Write the plan down and practice. 7. Review any insurance if applicable. Emergency management works when you and your local, state, and federal government fulfill emergency management responsibilities. Voluntary organizations also have important responsibilities during disasters, such as the Red Cross or Salvation Army. There are 5 phases of managing national emergencies. 1. Prevention. Actions to avoid the occurrence of hazards. 2. Mitigation. Actions to reduce the potential impact of hazards, for example, establishing building codes, zoning regulations, or drills. Preparedness, to plan, train, and equip for effective response to severe hazards. 4. Actions by first responders to save lives and property, such as search and rescue, providing medical attention. And 5. Recovery, actions to restore communities, that is, rebuilding infrastructure or providing financial and social relief to impacted individuals. Remember to call 911 if help is needed during an emergency. First responders generally have boots on the ground, such as the National Guard, FEMA, or your local police and fire department. Access the free voluntary program called the PA Premise Alert through your local police department or fire department. The PA Premise Alert was created in '04 by Susan F. Zucchildo and Police Chief Kevin McCarthy Sr. to provide a uniform method to alert first responders to the special needs of individuals in their community and support families and individuals with disabilities, challenges, or complex medical diagnosis in the event of a crisis. When personal care attendants set out to clean their consumers' homes, their mind probably wandered to topics like how long it's been since the shower was last scrubbed, whether there's time to clean out the fridge, or what should I use to clean certain things with. Very few people stop to think about chemical cleaning safety, especially as it relates to their overall health. Chemical burns occur more frequently than we think. This can occur when we use cleaning agents like bleach regularly or mix cleaning agents that has the potential to create toxic gas or fumes. If you experience severe chemical burns, call 911 or seek medical attention immediately, especially if burns are deep and cover a large area of your body. Be sure to provide the name of the chemical that caused the burn for more effective treatment. Accidents like fires, slips, trips, and falls, and food poisoning can happen in the kitchen. Tips for prevention of kitchen accidents include always paying attention to what you're doing in the kitchen, store knives in a wooden block or drawer, never cook in loose clothing and keep long hair tied back, never cook while wearing dangling jewelry, keep pot holders nearby and use them, turn pot handles away from the front of the stove, refrigerate temperature sensitive foods, wipe up spills immediately. Separate raw meat and poultry, wash your hands before and after handling food, and get a fire extinguisher. Also, practicing 4 basic food safety principles should reduce the risk of foodborne illness. The 4 basic food safety principles are clean, separate, cook, and chill. Tips for prevention of food poisoning include wash hands with soap and water, sanitize surfaces, clean sweep refrigerated foods once a week, separate foods when shopping, use clean cutting boards, use food thermometers, cook food to appropriate internal temperatures, and refrigerate foods as at appropriate temperatures. Accidents such as slips, trips, and falls and electrocutions can happen in the bathroom. Tips for bathroom safety includes using slip-resistant floor mats and tub mats, keep bathroom floors dry, keeping electrical appliances away from water, using grab bars and shower chairs when needed, keep bathroom well lit, secure fixtures like toilet paper holders, towel racks, and medicine cabinets, set hot water tank to 120 degrees to prevent scalding, or use ground fault electrical outlets to prevent electrocutions. Pet safety. This is a reminder that pet care is not a mandatory task for any personal care attendant, and consumers should not request this service from you. Pet care is not on any consumer's care plan. Please ensure that you provide detailed preferences if you are a floater who is picking up shifts with consumers. Informing the scheduling team that you do not prefer to work with animals avoids uncomfortable interactions or forcing consumers to lock away their pets. Please note that if a consumer is forcibly requesting pet care, you should respectfully decline and remind them of the policy or have your scheduler do it on your behalf. When in public or in a crowded setting, always utilize your situational awareness skills. Situational awareness is paying attention to your surroundings. Tips for situational awareness include identifying objects around you, noticing other people, identify entry and exit points, staying vigilant, or practicing self defense. Personal care attendants must travel by personal transport or commute to work. You also must think about traveling with your consumers from time to time. Here are some safe traveling tips. Wait for your ride share in a safe place. Verify the car and driver on the mobile app. Never stand on train track or walk in between train and subway cars. Never stand in street while waiting for a bus. Stand on the sidewalk. Always stand behind the yellow lines on trains and subway platforms and on buses. If your consumer has a disability, be sure the consumer can sit in a designated accessible area while riding SEPTA. Occasional severe weather conditions are unavoidable. What is considered severe weather conditions? These include high winds, hail, excessive precipitation, wildfires, thunderstorms, tornadoes, tropical cyclones, blizzards, or ice storms. Remember that you are an essential worker and your consumer still needs help and support in severe weather conditions. Follow call out procedures if you encounter severe or inclement weather and are unable to make it to your shift. If you are stuck at the consumer's home due to severe weather conditions, you may need to batten down. Do not attempt to leave until it is safe to do so. Please utilize the 24/7 on-call scheduling phone number to either call out or make a report on the situation. Consumers are often faced with an array of diverse circumstances and challenges. There are often things that can trigger aggression in your consumer's behavior. That can be chronic pain, mental health conditions, or, or dementia or Alzheimer's. Knowing how to de escalate aggressive or combative behavior is critical in ensuring your safety and the safety of your consumer. Completing advanced skills training courses through the Home Care Hub, such as nonviolence crisis intervention, dementia capable care, and mental health first aid, should arm you with the knowledge in de escalation. Please refer to your union handout for the link to sign up for Home Care Hub training courses or request the link to be emailed to you. As a personal care attendant, alertness is top priority to performing assigned duties on your consumer's care plan, especially if your consumer has limited to no mobility and or a fall risk. If you are physically and cognitively impaired due to the use of drugs or alcohol, this will severely impact the efficiency of your work and thereby put yourself and your consumer at risk of injury. Impact of narcotics use on the job includes poor judgment, impaired perception, impaired motor coordination, or withdrawal illness. Please ensure that you do not use drugs prior to or during your work shift. If your consumer is encouraging you to engage in drug use with them, please report immediately to the scheduler. You have now completed your yearly skills and safety training.